Welcome, and thank you for listening to this presentation. This training was developed by the Montana Asthma Control Program, a program within the Montana Department of Public Health and Human Services. Today I'm going to talk with you about an important health issue that has a significant impact on our school systems: asthma. My goal today is to help you learn more about asthma, especially as it relates to children and young people, and to make you more aware of some of the steps that the schools can take to combat this disease. I will be referring to the booklet entitled Creating Asthma-Friendly Schools in Montana as we go through this presentation. If you do not yet have a copy of this booklet, please download a PDF version of the booklet from the Montana Asthma Control Program website, which is located at dphhs.mt.gov/asthma. Now, let's begin. First of all, let's define what asthma actually is. Asthma is a chronic lung disease which causes many troubling symptoms. It is characterized by a reversible narrowing of the airways. Symptoms commonly experienced during an asthma attack include wheezing, tightness in the chest, coughing, and shortness of breath. Next, let's review the basic anatomy of the lungs and the airways. When we breathe in, air comes in through our nose and mouth and passes through a system of branching tubes. These tubes start with the trachea, indicated by number 1 on the slide, branch into the left and right bronchi, branch point is at number 10 on the slide, and continue to divide again and again. When the bronchi become very small, they become known as bronchioles, represented by 7 on the slide. Eventually, the air reaches the alveoli, indicated by number 5 on the slide, where oxygen in the air is taken into the bloodstream and carbon dioxide is expelled into the airways and finally out of the body. An asthma attack is characterized by a reversible narrowing of the airways, which causes the symptoms I outlined earlier. There are 2 ways in which the airways can become narrowed in asthma. One way is by swelling of the walls of the airways, caused by inflammation with excess mucus production. Another way is by constriction of the muscles surrounding the airways. The 2 mechanisms of airway blockage can occur separately or at the same time. No matter which mechanism predominates at any given time, the outcome is the same. The airway becomes obstructed. The obstructed airway blocks the normal flow of air and makes breathing difficult. Asthma is a common disease, both nationally and in Montana. As of 2014, 7.1%, or an estimated 15,400 Montana children aged 0 through 17 have asthma. The percent of Montana children with asthma increases to 10.1% among children ages 12 through 17. This means that in a classroom of 30 students, about 2 to 3 will currently have asthma. Asthma is especially important to address in the school setting because of the large impact that asthma has on both school attendance and student performance. However, with proper planning and informed policy decisions, asthma can be successfully managed in the school setting. So how well are Montana schools actually addressing asthma in the school setting? As of 2014, only 16.2% of Montana schools provide information on asthma to parents and families, while over 50% of lead health education teachers want more professional development on managing asthma. Only 17.9% of Montana schools provided professional development related to asthma. The Creating Asthma-Friendly Schools Resource Guide outlines 7 steps that schools can take to work toward creating asthma-friendly schools. The first step is to identify students with asthma. The second step is to allow students easy access to their inhalers. The third step is to create a school-wide protocol for handling an asthma episode. Step 4 is to identify and reduce common asthma triggers. Step 5 is to enable students with asthma to participate in activities. Step 6 is to educate staff, parents, and students about asthma. Step 7 is to collaborate with families, students, staff, and health providers. We are now going to go through the steps one by one. As we go through the steps, I will cover why each step is important and what actions can be taken to complete each step. The first step that a school should take is to identify those students who have asthma. It's important that schools identify which students have asthma every year, as students may develop asthma throughout their academic careers. Schools should then ensure that the proper paperwork, such as medication authorization forms, is collected to help facilitate their care at school. Finally, there needs to be a system in place to communicate to the school staff which students in their classes have asthma and what steps need to be taken to care for them. This is an example of a recommended form that allows students to self-carry and self-administer emergency medications. A copy of this form can be found in the resource guide. This form complies with the Montana law requiring that students with asthma, after proper authorization, be allowed to possess or self-administer asthma medication. The form requires signatures by both a parent or guardian and a healthcare provider. Here are a couple examples of what an asthma action plan can look like. An asthma action plan contains information about the steps to take when a student is having different asthma-related symptoms. Step 2 in creating an asthma-friendly school is to ensure that students with asthma have easy access to their inhalers. Access should be ensured for the wide variety of activities in which students are involved. Quick access to medications will prevent asthma symptoms from turning from bad to worse. If school staff become aware of asthma medication basics, they will recognize the importance of ensuring students easy access to their inhalers. Before we cover this step in more detail, I will give you a brief overview of the types of asthma medications. Asthma medications can be divided into two categories. One is controller medications, and 2 is rescue or quick relief medications. Controller medications are taken every day to prevent asthma attacks. They are usually taken at home. Common names of controller medications include, but are not limited to, Advair, Symbicort, Singulair, Ceravent, Pulmicort, Qvar, and Flovent. Rescue or quick relief medications are taken only as needed and are used during an attack to obtain relief of symptoms. They need to be readily available for students with asthma. The common name of rescue or quick relief medicine is albuterol. To help students with their disease, it is helpful to know the difference between the rescue and controller medications and when each type of medication is used. In Montana, there is a law, MCA 25420, that allows students with a medication authorization form on file to carry and self-administer their own asthma rescue medication. However, those students who do not carry their own medication also need easy access to their medication. Allowing easy access to medications allows students to prevent more severe symptoms from developing and also helps to protect the school from unnecessary legal liability. In order to ensure easy access, school staff should encourage students with asthma to self-carry or to store their medication in a safe, accessible location at school. It is important for all school staff to respect the right of students to self-carry their medication. Step 3 involves creating a school-wide protocol for responding to a student's asthma attack. This is critically important, as it is possible that a student could have an asthma attack at any location throughout the school. Thus, having a protocol in place may potentially save a child's life. This is a sample school-wide protocol. It is taken from the resource guide. This or a similar protocol should be posted widely around the school. Posting this widely around the school will enable a quick response to an emergency situation. When a student has an asthma attack, you may have to assist them as they use their inhalers. These are the required steps to use a metered dose inhaler. We will demonstrate these steps so that you may better be able to assist your students with using their inhalers. Remove the cap and shake the inhaler. Tilt your head back and breathe out. Put the inhaler mouthpiece between the teeth with tongue underneath it. Compress the canister. Breathe in slowly for 3 to 5 seconds. Hold breath for 5 to 10 seconds. Exhale. Wait at least 1 minute and repeat puff as recommended by healthcare provider. Additionally, some students will use a spacer with their inhaler, which has the potential to increase the amount of drug that reaches the lungs. The use of spacers is recommended for everyone who uses a meter-dose aerosol inhaler. To help a student use their inhaler with a spacer, follow these steps. Step 1. Remove the cap from the inhaler. Shake the inhaler. Put the inhaler in the spacer. Put your lips around the spacer mouthpiece and exhale through your nose. Press the inhaler and take a deep, slow breath in for 5 seconds. Hold breath for 10 seconds. Exhale. Wait 1 to 3 minutes before administering a second puff. Repeat as necessary. Some students will use a peak flow meter to monitor their asthma over time and to help them decide what steps to take when they have an asthma exacerbation. To assist a child with using a peak flow meter, have the child stand up and position the indicator at the bottom of the numbers. Some people with asthma do not have allergies. However, at least 80% of children with asthma do have allergies. Non-allergic asthma and allergic asthma are the same disease, except for the absence of allergies to specific triggers. Anaphylaxis is an allergic reaction that affects the whole body. It occurs if the body has an especially intense reaction to an allergy-causing substance. Common allergy-causing substances that may cause anaphylaxis include bee stings and food such as peanuts or shellfish. Anaphylaxis is a life-threatening condition, as blood pressure can drop dramatically and the child can go into cardiac arrest. There are several symptoms of anaphylaxis to watch out for. These include sweating or paleness of the skin, lightheadedness or fainting, hives and itching, swelling of the skin, lips, mouth, or throat, stomach cramps or vomiting, and difficulty breathing. These symptoms usually occur within a few minutes after contact with the allergy-causing substance, but can also present hours after contact with the allergen. If a child is experiencing symptoms of anaphylaxis, it is necessary to immediately call 911. If you believe a child is experiencing anaphylaxis, you should also give an injection of epinephrine. One of the most commonly used devices for injecting epinephrine is called the EpiPen. In Montana, there is a law, MCA 25420, that allows schools to stock epinephrine and administer to students in emergency situations. We will demonstrate how to use the EpiPen in a short video. Before use, the EpiPen should be stored in a dark area and kept at room temperature. You should keep track of the EpiPen's expiration date and be sure to replace it before it expires. To use an EpiPen, form a fist around the EpiPen with the black tip pointing downward. With your other hand, remove the gray safety cap. Do not touch the black tip after removing the cap. Push the black tip firmly against the outer thigh of the child who is having the severe allergic reaction for 5 to 10 seconds. You can remove the EpiPen and massage the injection area for a few seconds. Check the black tip to ensure that the needle is exposed, so that you know the child has received the dose. If they have not received the dose and the needle is not sticking out, repeat the previous steps. Ensure that you have called 911 so that the child can go to the closest emergency room. The effects of the EpiPen will only last 15 to 20 minutes, and anaphylaxis is a life-threatening condition. If you're interested in learning more about anaphylaxis, the Montana Asthma Control Program has also developed an allergies and anaphylaxis training for schools that can be found at dphhs.mt.gov/online asthma trainings. Teachers and other school staff can learn about anaphylaxis and earn OPI renewal units for completing the course. Step 4 in creating asthma-friendly schools is to identify and reduce common asthma triggers. Asthma triggers are those things that can start an asthmatic reaction in your airways. Many of these triggers are things that people inhale. Common asthma triggers in the school setting include school bus exhaust, tobacco smoke, allergens like pollen and animal dander, strong cleaning products, and cold air. Asthma triggers are different for each person with asthma, so it is important to find out which asthma triggers affect the students at your school. The resource guide lists simple steps that can be taken to reduce asthma triggers in the school environment. For example, keeping windows closed when pollen levels are high, and using low volatility organic compound cleaners can both help to reduce triggers. School policies such as the elimination of school bus idling, creating a comprehensive tobacco-free school, and practicing integrated pest management can also be effective at reducing asthma attacks at school. Step 5 is to enable students with asthma to participate in school activities. This involves dealing with exercise-induced asthma. Exercise-induced asthma involves airway narrowing in people with asthma that is brought on by vigorous exercise. It is quite common, affecting up to 90% of people with asthma. The symptoms that people experience during exercise-induced asthma are the same symptoms that normally occur in an asthma attack. Those symptoms are the ones I mentioned earlier in this presentation: chest tightness, difficulty breathing, wheezing, and coughing. Although symptoms can occur during exercise, the symptoms are often experienced shortly after exercising. In fact, the symptoms often peak 5 to 10 minutes after exercise is completed. The airway narrowing can spontaneously resolve 20 to 60 minutes after starting, although it may last longer. Although exercise-induced asthma can be serious, it can be effectively controlled. When asthma is well controlled, students with the disease should be able to fully participate in school activities. Step 6 involves educating your fellow school staff, parents, and students. Since asthma is so common, it is necessary that everyone involved with students receive education on asthma. In particular, teachers have often not received recent training on asthma, and it's clear that many want additional education. In addition to the information in the resource guide, there is a useful guide produced by the National Heart, Lung, and Blood Institute called Managing Asthma, a Guide for Schools. The guide is located at the website indicated on the slide. There are also links in the Creating Asthma-Friendly Schools guide to further resources on specific topics that may be helpful in learning about and teaching others about asthma. In order to create an asthma-friendly school, the efforts of many people are required. Thus, Step 7 involves collaboration between all of the different groups of people that have a stake in creating asthma-friendly schools. Since many different tasks and skills are involved, collaboration and cooperation between all affected parties is critical. One of the key ways that your school has the potential to greatly improve student health, including issues related to asthma, is to increase communication between staff and the school nurse. If your school does not have a school nurse, this could be a key resource that you could add in the future. Before we conclude today, I would just like to briefly reiterate a few key points. First of all, remember that asthma is a disease that is characterized by a narrowing of the airways. This narrowing can be caused by both inflammation and muscle constriction. For treating asthma, 2 types of medication are utilized: controller medications, used for long-term maintenance of asthma, and rescue medications, used to treat symptoms as they appear. Next, remember that students are allowed to self-carry their own asthma medication in Montana. This requires completed paperwork with signatures by the student's parent or guardian and healthcare provider. Finally, remember that asthma triggers cause asthma reactions in the airways of people with asthma. Removing and/or reducing these triggers can lessen the chance that students will have asthma attack. Removing and/or reducing these triggers can lessen the chance that students will have asthma attacks at school. That concludes our overview of asthma and the steps to take in creating an asthma-friendly school. Thank you for taking the time to learn a little about creating asthma-friendly schools. If you have any comments or questions about this presentation, please do not hesitate to contact us. The contact information for the Montana Asthma Control Program is on the slide.